Everyone, today we'll be talking about hemoptysis. So hemo means what? Blood. Tysis means vomiting out blood. So that means expectorations of the blood anywhere from the respiratory tract, okay, that is glotis to alveolus. That condition is called as hemoptysis, okay. And then hemoptysis is of four grade, that is mild, moderate, severe and very severe, okay. Mild means if the amount of blood that is expectorate, that is less than 100 ml per 24 hour, that is called as mild. Moderate means 100 to 150 ml per 24 hours. Severe means 150 to 200 ml per 24 hour. And very severe means that is 400 ml per 24 hour, okay. And then this our lungs has dual blood supply, okay. One is pulmonary circulations, which is of low pressure systems, and then we have bronchial circulations, which is of high pressure systems, okay. So that is the region from where bleeding take place, okay. That is the things. So let us approach the case first. So you can see over here, okay. So patient with hemoptysis. So initially we have to take history and physical examinations, and we have non-massive and the massive, okay. And non-massive means no risk factor, okay. No risk factor means treat underlying diseases, okay. We have to treat the underlying diseases. So there is no, there is non-massive and then there is no risk factor. Then what happens? We have to treat underlying disease, usually infections, okay. If again there is persistent bleeding, then what happens? We have to do just x-ray, CBC, creatinine, coagulation studies, okay. Uric acid also we have to look for, okay. And then if non-massive, then what happens? We have to look for risk factor, okay. So there is risk factor. So what happens? We have to do chest x-ray, CBC, uric acid, creatinine, coagulation studies, and then we have to do CT scans, okay. So if not, then what happens? We have to do, if we cannot find the cause, then what happens? We have to do bronchoscopy, okay. If we can find something in the bronchoscopy, then what happens? We have to treat the underlying diseases, okay. So that is the things that is non-massive, which is with risk factor and no risk factor. But if there is a quantify amount of bleeding, we quantify amount of bleeding, and the bleeding is massive, then what happens? We have to protect the airway, okay. So protection of airways will be the most initial step, okay. If the bleeding stops means we can do anything, we will wait and watch, okay. If bleeding continues, then what happens? Immobilizations or resections, okay. So what happens? We have to do immobilization or resections for that side, okay. And then to prevent bleeding, we have to change the position variations, and we have to maintain the vitals, okay. And then we have to immobilize or resections of the that structure, okay. So that is the things. Also if there is persistent bleeding, also we have to do immobilizations or resections, okay. So patient on hemoptysis, non-massive, massive, with risk factor, with no risk factor, okay. With risk factor, look for chest x-ray, CBC, uric acid, creatinine, coagulation studies, CT scans, and then we will do CT scan. If we can find the lesions, then we stop over here. But if we cannot find the lesion, then what happens? We have to do bronchoscopy, okay. And we have to treat the underlying diseases. If again the bleeding is continuing, okay, then we have to do the last step, that is resections or immobilizations, okay. In this way we discuss about approach to hemoptysis, okay.